good to see everybody tonight. I'm sorry I missed last week. I was in Montana, and in the hills, so I didn't have reception for much of anything. So I hope it was a good one. I'm sure it was. But just know that I guess Mary's got ABODE Academy. This is ABODE Academy 3, and the first 2 sessions are now on the website. And you can go to abodehome.org/education, and then just go to ABODE Academy 3, and you'll be able to find the last 2 sessions that we've done. This is our halfway point. We've got 3 more weeks after this, and ABODE Academy 3 is done. And we're so grateful that all of you joined us, and you're helping to make this a success. When I joined the board at ABODE, well, that's a hard thing to say. My goal was to reach out to the community and to provide education that's you just don't find anywhere. And so this has just been a lot of fun, and I really enjoyed bringing education and programs, out to the masses. And if you've attended before, you know that you'll get a survey the following day. And on that survey, it'll ask, what do you want to hear about? What do you want to talk about? Because ABODE Academy 4 will happen in January. And we're going to start planning for that here in the next few months. So if there's a topic that's just on your heart or on your mind, let us know. The next 2 weeks, we've got some speaker changes and some scheduling changes, and I'll just go over those real quick. Next Thursday, the 5th, we're doing Managing the Family Dynamic. Oh, that's a tough one. And we have Byron Cords from Sage Management, and he's kind of an expert in this. Sage does like adult care, geriatric care, kind of a consulting. And so they meet up with a lot of families to kind of help them get through the process. And so Byron's going to give us some great expertise on managing that family dynamic. And that's a huge part of my job. And I'm going to take Byron with me one day, let him deal with it. On Thursday, the 12th, we have self-care, put your mask on first. And that's going to be presented by Denise Kermsey. And so, that'll be a good one for everyone. If you're a caregiver, you've been a caregiver, you know how important self-care is. Put your mask on first. So, and then we're real excited. In about 3 weeks, we're going to have our staff volunteer training. And that's going to be the weekend of August 20th. That's a Friday evening. And then Saturday, the 21st. And we're going to just educate our new volunteers, our old volunteers, our staff, and just, if you're interested or have even a little bit of interest, just come and see what it's all about. There's no commitment, but just come and find out, because the house is open and we need volunteers badly. So, if you're interested, go to the webpage, all the information's there. Call Mary, call me, text me, and I would love to have you. So before I introduce our first speaker, Susan, I think you're going to do our contemplative moment.
Yes.
Okay. So.
Okay, this reading, I want to read it and then have you just sit for a while in silence and let it kind of sink in. It's called Whenever He Looks at You. God sees nothing in us that He has not given. Everything is empty until He places what He wishes into it. The soul is like an uninhabited world that comes to life only when God lays His head against us. The delight a child can know, tossing a ball into the air, my Lord confessed, He experiences whenever He looks at you. God sees nothing in us that He has not given. And taking a final, send out good thoughts to all those around and know that God delights in you.
Thank you, Susan. That was beautiful. That was beautiful. Well, tonight we're going to talk about we can't care for mom at home. Now what? And this is a very pertinent topic. You know, how many times I've gone into a home with a new patient or visited a family in the hospital to put them on hospice, and they just say, well, you know, go home now. Now what are we going to do? Who's going to do it? And what is that going to look like? And it's a real stressful time. So tonight we have two wonderful speakers. I'm going to introduce our first one, and then Mary will be our second one, and I'll introduce her when when her turn comes up. But we have Rigo Montero. He's a licensed master social worker, and he's a former hospice case manager, and for the past 6 years, a hospice care consultant with Embrace Hospice. Through the years, Rigo has met with many family members who have experienced caregiver fatigue, recognized they were no longer able to care for their loved one at home, and made the difficult decision of seeking an alternate living situation for them. Rigo's years of experience in the healthcare system and in the community have allowed him to establish solid relationships with various placement entities, nursing homes, assisted living facilities, and personal care homes. And this way he's better to assist families he serves. So I'll let Rigo take it away. And before
Thank you very much.
Remember,
Go ahead.
we're not going to do the chat box. If you have a question, just jump right in. Okay, Rigo, go ahead.
All right. Hey, thank you very much. And first of all, let me apologize first, because I had every intention of sitting at home in front of my computer and doing this. But as we all know in the hospice world, those phone calls come in at the very last minute. Families are kind of in distress and whatnot. And so I just finished wrapping up a consultation with the family and everything. And in fact, it just kind of lies right in line with what we're talking about this evening. And it's a family trying to look for placement for their loved one. And I'm also privileged and honored to be asked to be presenting. I hold ABODE in the highest regard. They're a godsend for our community. They've, you know, since I was a case manager and whatnot, I was like, man, why aren't there not more facilities like this, more places like this? And so I really appreciate what ABODE's been doing for our loved ones in the community and what they've offered and the love that they've provided for a lot of, you know, folks that have had the privilege of living their final days, you know, here. So when Mary asked me if I could present on this topic, it's something that I kind of don't even think about, because it's just almost second nature when it comes to when the hospital, the doctors, whatnot, ask me to meet with the family and they're presented with this situation. And sometimes the doctor or the case manager of the hospital gives me a heads up saying, Rigo, just letting you know, the family is very overwhelmed. They don't know what else to do. You know, they love their mom dearly. They love their dad dearly, but they don't know, they can't do this any longer. What, you know, can you help them? Or I find out firsthand when I go and meet with them and say, like, we can't do this. And you can just see it in their face, in their posture, that they're tired, you know. And as much as they love mom, dad, grandma, grandpa, brother, sister, they got their own issues, their own medical issues they're dealing with, their own jobs, their own families that they're tending to, that's become too much for them to continue to care for mom. So it's like, what do we have? What else do we do? What do people do in my situation, Rigo? And so we started looking at alternative placements, you know, and what do those consist of? And the first placement that people think of is nursing homes. And of course, San Antonio and surrounding areas are filled with outstanding facilities, nursing home facilities. But it's not, you know, the process of getting into a nursing home is not that simple. And I think I've been asked this evening, and if anybody needs to stop me or correct me or redirect me, please let me know. Okay. But I was asked to kind of break down what facilities and what's required of each facility. And there's always going to be a little caveat. There's always on a case by case, but yeah, I'm just talking in the general scope what each of these facilities require. Okay. And first and foremost is nursing homes. Like, well, you know, we've got this ABC nursing home down the street. We want to place mom there, so make it happen. It's covered by hospice. That I was like, well, it's not really covered by hospice. So what I always break down is nursing home. What does it take to place mom in a nursing home facility? Well, of course, the nursing home have their own criteria. They've got to have the cognition, the medical need, medical necessity to be medically accepted there at the facility. But I think more so it's the financial part of what it takes to place a loved one in a nursing facility. And I always break it down to the three general areas that are covered, that cover the cost of a nursing home. First one is Medicaid, okay? Medicaid is obviously, you know, income-based and on a, you know, assets, properties, whatnot. And of course, nursing homes will ask for that, bank statements and whatnot. They have to meet a certain criteria, medical criteria, to be medically, financially accepted to a nursing home, okay? Second is long-term care policy. And my experience doing this for several years, I would venture to say 85% do not have a long-term care policy, okay? Those 10, 15% that do are still not well-versed in what that policy, how that works. And again, I'm not an expert. I'm not going to pretend like I'm an expert in long-term care policy. It's just what I've gathered through the years is each policy is different, just like insurance. You know, not every hospital takes this insurance. Not every doctor takes this insurance. So not every facility will take a certain, you know, long-term care insurance policy. So I always encourage them to, you know, I guide them to the business manager and let them run it and everything. Even if they are in network with that insurance or they do take that policy, a lot of times people say, well, there, it's covered. We're good to go. You know, we're good. Well, not necessarily, because again, every policy is different and there's a grace period before that policy kicks in. 30 days, 60 days, 90 days. And again, in my experience, they're typically in the 60, 90 days. All right. So that means the family or the patient, the resident, are still responsible to pay up front those first 30, 60, 90 days before that policy kicks in. Once it kicks in, it's not an automatic thing either, okay? The family's still responsible to pay the facility, and then the insurance reimburse the family. So again, nursing homes, if you've ever priced them, they usually range from $6,500 to $7,500 a month. Lots of money. You know, and so I always caution people, like, you know, just make sure we talk to the business manager so there's no surprises, there's no hidden fees, there's no, you know, well, I wasn't aware of that. So we want to make sure. So we always get that done in advance and make sure that everybody's on the same page. Okay.
Rigo, when you talked about a medical necessity, what does that mean?
Not anybody can just go to a nursing home. Okay. Well, mom, I can't take care of mom. So they have to have a cognition, issue that they're not able to care for themselves. Okay. Dementia, you know, Alzheimer's, you know, they've got issues going on. And I want to be clear because I know it's like ABC nursing home is also rehab. Well, they took mom as a rehab candidate. Well, yeah, because she had a knee or hip replacement, or she had some cardiac issues that she's getting some rehab done. That's different. That's rehab. That's short term. That's covered 100% by Medicare in this situation for the first 30 days or so. That's rehab. That's different than long-term custodial, you know? And so they have to have a medical necessity to meet that criteria. And to answer your question, it's, you know, they've got some kind of mental, they don't have the mental capacity to take care of themselves or meet their own needs. So they need to require that care, 24-hour care.
Isn't it true, Rigo, that the person might have a physical disability too, or even an end-stage disease process would allow them to go into long-term care?
You know, and that's a very tricky question because, you know, and we've been faced with that too in the hospice world when we say like, well, this patient has a physical disability, but their cognition is all up there. They're you know, alert and oriented times, you know, 4. I mean, they've got it all. They don't meet the medical necessity for long-term care because they don't have they're still with it, is what they call it. Okay. So my job, I help with the families. Like, I'm going to dig up some records, go back, go to the hospital, go to the doctor, try and find something that has some kind of indication of some kind of cognition inability. Does that make sense? And so, yeah, you're right. A lot of times, well, mom can no longer walk. She can no longer ambulate. So I think she qualifies for nursing home placement. That's not always the case, unfortunately. Okay. So I work really closely with, of course, the families and their physicians and also the nursing home to see what exactly do you need, do you need stated, documented, so that, grandma can, be admitted into your facility. Does that make sense to answer your question, sir?
Yes,
All right.
It's a little confusing, but the process.
It is.
Isn't it true that it's been changing over the years too? I mean, I worked in long-term in hospice for many years as a chaplain and took care of quite a few different people in nursing homes who didn't have issues with forgetfulness or dementia. So it just makes me wonder if the criteria for Medicare or I guess it wouldn't be a Medicare issue. It would be the regulations
Medicaid.
for admitting into nursing homes has changed.
Oh, he's talking about
Right. And that's why we have to be, that's why I always make the distinction between Medicare and Medicaid. Okay. Medicare, like I said, if somebody's got Medicare and they just got a total knee or total hip replacement, and the doctor thinks they need a benefit from a few more days of rehab, absolutely. They're with it. Their cognition is on point. They're good, but they're there for rehab. They're not there for custodial long-term. So that's why I always do, because I encounter this all the time when the family says, no, mom was there just a year ago. And we have to remind them that they were there for what they call SNF, skilled nursing, not for custodial. So yeah, and it does get confusing. The whole healthcare system is very mind-boggling. Okay. And even though I've been involved with it for many, many years, you're learning things new every day. Things change every day. And you're right. I mean, what was good last week is not good this week, or vice versa. Hey, you know what, Rigo? We are taking that this week, we just got, handed down that Medicaid's accepting so we jump on that, so we always try and stay on top of that. Okay. Speaking of which, again, with Medicaid, so even if somebody has Medicaid, what most of you, if they haven't lived in a nursing home, they got what they call community Medicaid, which is fine, but that's not nursing home Medicaid. So they still have to apply for nursing home Medicaid. It's not just an automatic, shoe-in to nursing home. Now it is already, they're already ahead of the 8 ball because they already have Medicaid. As you all know, applying for Medicaid is a tedious process. But once they already have Medicaid, that's great, but that doesn't automatically approve them from nursing home Medicaid. So they still have to provide certain documentation for the nursing home. And then lastly about that is a nursing home can be accepting Medicaid patients this week. Next week, they might have met their number of Medicaid beds. So they're not taking Medicaid patients at that time. So we'll have to try again next week or the next month or something like that. So again, what you just mentioned, sir, was, what changes? That changes too, and that's per facility. Okay.
And
Any
just
other questions about that? Go ahead.
know what Medicare versus Medicaid is. Can you go over that real quick?
Yeah, I'll do my best because I get that told a lot and everything. I try to make it as not complex as possible. Medicare is what we put into the system, what we see deducted every paycheck. That goes into, that's what you put into the system. They call them quarters. You put into the quarters, you get that. And so when you finally reach 65, and you get Medicare, that's something that you get back. Okay, that's what hospice falls under. That's what so that's a benefit that's entitled to persons that already put in to the system from their employment or their spouse. They worked on behalf of their spouse, and so they get that benefit back. Okay, so I always say it's what you put in, through work and everything. Medicaid is income based. Okay, it's when a person has a certain income level that they meet that qualifies them for the Medicaid. they're aiding, they need that aid because they're not able to meet all their, their financial needs. Okay. With their, just only with their social security check, with their disability check, that's what qualifies them for Medicaid. So I know it's kind of confusing. Can people have both? Absolutely. Okay. Their Medicare and their, they put into the system, but yet what they're receiving is not enough to sustain them, so they can apply for Medicaid. Okay. And there's no age limit with Medicaid. Okay. There's kids that have Medicaid, there's, adolescents, and so there's no age limit as far as Medicaid is concerned. Okay. Medicare, there are certain circumstances where people younger than 65 do apply for Medicare. That's a whole nother story that I'm not going to get into that. So, but most often than not, it's 65 and older. Okay. So that's Medicaid. That's what helps offset some of the cost of nursing home placements. Like I told you, the second thing is long-term care policies. And then the third one is, of course, out of pocket, and sometimes people don't qualify for Medicaid because they've got maybe too much in the bank, too much in their savings, too much property, too much of that. So what the nursing home will tell the folks is spend down, because somebody should have no more than $2,000 in their bank account to qualify for Medicaid. So they need to spend down to that amount. That doesn't mean if somebody has $50,000, well, my mom has $50,000 in the bank, so I'm gonna go buy myself a new Jeep so I can spend down and she can qualify because now she's got $2,000 in the bank. Absolutely not. Medicaid goes back 5 years, and all that spending has to go towards that person's care. Whether you had a provider, whether it was her medication, whether sometimes people pay themselves, but they have to show receipts. I took care of mom for 40 hours this week. I've got to show receipts that I clocked in, clocked out, or whatever. It's a really, they're very specific on that. Okay. So I always tell people, like, whatever you're going to, don't go and change, or don't go put your money in Rigo's account, because again, Medicare will go back and look at that. Okay. Just kind of, honestly, genuine, just legitimately spend down towards mom's care. So when and you can always spend it at the facility. All right. So mom's got $10,000 in the bank. We need to spend down. Okay. That should cover about a month and a half, 2 months of nursing home placement. So she's just spent down, and then she can qualify for Medicaid, and they'll do the process while she's there. Okay. So I'm sorry if I'm babbling. I'm just trying, because it's something that I'm always generating. I'm always talking. I try to now, tone it down a bit. So that's nursing home. So if somebody, Rigo, mom doesn't qualify for Medicaid, but yet she can't afford, she can't afford, she makes too much for Medicaid, but we can't afford the $7,000 a month nursing. What else is out there? Well, that's when we start looking, what are mom's needs? Well, she can probably do some things on her own. She just needs somebody to come check on her every now and then, but she can do it. Then that's when I propose assisted living facilities. Okay. Assisted living facilities, again, San Antonio surrounding area are filled with tons of great ones. Okay. And that's what they are. They're apartments, and I'm sorry about that. Are y'all there? Okay. Sorry about that. Anyway, assisted living, they have their own, apartments and whatnot. They're all different varieties. Some of them make them very resort-like. Some of them make them just, apartment-like, which is what I just left this evening. So there's very different ones, but that's when the patient can still kind of do some things on their own. They just need a little bit of assistance. All right. And, those are mainly private pay. There are some that do take long-term care policies as well, but most of them, are all private pay. And they start out very low, but a lot of things they do is a la carte. Well, if mom needs somebody to help her with laundry, okay, well, that's going to be X amount per month. If she needs somebody to kind of help her to the meeting, social area, cafeteria, that might be a little bit extra a month in this sense. So there's a little a la carte things on that level. And then the third one is like, okay, well, mom needs a little bit more attention than that. She needs a little bit more supervision than that. She needs a little bit more care than that. But again, we can't afford the nursing home. But assisted living, yes, the price is fine, but she needs more supervision. What do you offer? What is out there? What's going on has been going on for years, for decades, but has been really the trend recently that I've seen more and more pop up is what we call personal care homes or residential care homes. And this is basically people that have transformed their own private homes, or maybe they bought a home and everything, they transformed it to like private living quarters for our elderly, okay? And they've got 24-hour staff that are there. They care for them. They tend to them. They cook for them. They change them. They bathe them. They do all that. All, from my experience, has been at least half the cost of what a nursing home would cost. Okay, the ratio smaller. They're just a more home-like environment. Okay, is everybody a personal care home material? It all depends on which home we're looking at. I've got homes that do to a T that I've told my daughter, put me in a home like this one. Okay, not because the cost is lower, not because it's closer to home. It's just I see the ratio, because typically some of these homes have 3, 4, 5 residents in the home. That ratio has just gotten smaller than what you would get in a nursing home. Okay, so it's not for everybody. Some people love the nursing home. The nursing homes are very much needed. Some love the community, the atmosphere, and some are a little bit more private. And maybe a personal care home is more to their liking.
Go over
And
the
so
cost, Rigo. What are those costs?
absolutely,
Nursing home is $7,000. Assisted living, what does that cost? And a personal care home?
That's what I've done in the years, is just kind of establish my contacts, my folks, and one, it is all about geographic. Here in San Antonio, where you live, the cost of living makes a big difference. But I've got homes, and I'm talking about solid homes because that's what I'm saying. If I want to put somebody there, I better be willing to put my mom there. And that's the outlook that I always take on any time I offer any kind of suggestions or recommendations to families, to case managers, to average Joes out in the street. I want to make sure that if I'm going to put their mom, I'm willing to put my mom in there. And so these rates can range from $1,500. I've got outstanding homes from the $1,500 range. So of course, if you want what we call the bougie ones, you're talking about almost $6,500 a month as well. Okay, it's all about geographic location and what mom, dad, what fits their need. So I hope that answered your question. But I've got they start from $1,500, and a lot of these personal care homes. I'm sorry, I didn't interrupt.
How much is
a lot of
assisted living?
I'm sorry?
You didn't give a cost for assisted living, the ALs.
Yeah. Okay. Yeah, and the same thing too. Those also start off the same. You can get a really solid one for about $2,000 a month. Okay, maybe even $1,800 a month. But the caveat with that is, like I told you, the a la carte.
Mm-hmm.
If mom just needs somewhere to stay, somewhere to live, something she can cook, she can clean, she can still do some of these things, then you're looking, $1,800, $2,000 a month, and of course they start going up as far as location is concerned. All right. But then she needs help with cooking. She needs help with laundry. She needs help with getting to some ADLs, activities for daily living, this and that. You're going to probably start that bill's probably going to start looking at about $4,000 a month, $5,000 a month. Okay. Up until, also like the 7,000. I've got some that are in assisted living, but the family say mom loves it there. And that's what they want to look at. Where's mom going to be comfortable? Where's dad going to be the most, comfortable? And sometimes these families say, what, that's what it's going to take. That's what we're going to pay. Dad saved up. Dad has this, cash out here. This is what he wants. He never wanted to burden us. Not that he's a burden, but he's always said, I don't want to burden y'all. This is what I've saved up so that you guys don't have to, worry about that. And so I've got folks living in those places. So
I have a question.
Absolutely.
When if the loved one just says, no, I'm not going, I don't want to go, and that's where I'm at. My mom's 93 and I could see her benefiting in assisted living, but you're asking her to leave her home of, 50 plus years and she's just not having it. No.
Uh, I, I 100% empathize with you because I hear that quite a bit. You know, I hear that, that mom doesn't want to go. This is her home. This is this and that, whatever. And, of course, in the hospice world, and again, I'm just talking in the hospice world, I always tell the families, well, let's see how it works with us involved before we make that jump. You're going to get additional care. You're going to get additional help or get additional support. Let's see how that it works first. But that's with hospice. Without hospice, it's very tough. But this is where that patient, and in your case, your mom's cognition, or, where that medical power of attorney kicks in. Okay. Because if I've got a patient with Alzheimer's and just very confused and everything, that's what that medical power of attorney is there for. If you read that medical power of attorney clearly, it's just when the patient, and they usually sign it themselves. Obviously, they sign it themselves and says, when I'm no longer able to make sound decisions for myself, I designate my daughter, or my son Rigo to make those decisions for me.
Yeah,
And
that's
that
not
should be
our
a true.
case. My parents are
No.
very sharp. And so I was saying earlier before the meeting started, we're going down the road of home caregivers, home, paying. I think the minimum up here in Ohio is 4 hours a day for 5 days a week, 20 hours total that you can arrange any way you want, but it's roughly, you got to commit to 20 hours a week. So that's our plan B right now, because plan A, when we wanted them to move to assisted living last summer, ain't gonna happen. And assisted living isn't perfect. People fall in assisted living places. People bad things can happen in assisted living. And so it's not perfect. And as you know, with cognition, elderly people changing their environment is risky.
Yeah.
So like I said, we'll see, but our family is going to try home caregiving, which may be a little expensive, but it's probably cheaper than assisted living. And
Yeah, I mean, and it is, and especially if the patient, if our loved ones still have other faculties with them, it makes it a little bit difficult. But what I've also encouraged people is take them on a tour. I don't know if you take mom and dad to take a look at some of these facilities, but sometimes that makes a difference because in their mind, they've got their visual, whether it's through movies or through friends that have been through, certain places and everything. That's what's ingrained in their mind. Is like, oh, no, you're not going to put me in something like that. And once they see it, it's like, oh, this is not how I envisioned it, or this is a little better. And again, it's not that it's for everybody, but sometimes I just encourage them. And I mean, you'll be pleasantly surprised when they say, oh, well, we can probably make this happen. We can probably, let's give it a shot and see how that works, and that's how we kind of do those baby steps, so if they're still with it and they still got it, I would encourage, like, hey, let's just take a real quick trip and see how this place looks, it sure wouldn't hurt,
Yeah, well,
Do
thank you.
private caregivers charge? What kind of cost are we looking at?
Well, I've researched 3 different ones. Like the big ones are, Visiting Angels and Home Instead. They're $20 an hour or 22, something like that. And you have to commit to 20 hours a week. I'm going to try to go with this other one that I think is a higher quality because there's a case manager over the caregivers. It's a health professional. And I just felt like there'd be more medical intervention and supervision, and they're $28 an hour. So I just did the math. 28 times 20 times 4 weeks is like $2,200 a month. So we're gonna try it, I hope. I mean, we're meeting for the first time tomorrow with this care, they call her care manager.
Mhm.
And we'll see, but at
Yeah.
this point with my parents, just fragility and safety risk, like, that's what I'm gonna sell them on is you want to live in this big house. I understand that all by yourself. Well, we have to ensure more safety, and I keep telling her we got to build our team. Right now, the team's pretty small, just the daughters. We need more people on the scene. So she's open to that.
Yeah. I mean, I think, and again, if I can just piggyback off what you just said, ma'am, um, I mean, I always encourage, like, see how much more we can do in the home. And more often than not, the patient themselves, again, if they're still, of sound mind and everything, they kind of start saying like, yeah, I think I need more. Mom, you almost fell again yesterday. Or mom, you don't want to fall because you don't want to wind up in the ER again and da da da. And so a lot of times they start saying, okay, I think she's exhausted everything that she could here at home. I think it's time for the next step. I wish it was as storybook as that,
Right,
but
it's
I have seen, yeah, but I have seen when the family member has tried to exhaust all options, their loved ones are saying like, okay, there's nothing more that can be done. What's the next step out of this? You know. And then if I could just kind of, and again, anybody can jump in. My go-to when I'm at the hospital, especially, and I'm with the family, and they say we don't know what else to do, and mom's just got a few weeks left, and we can't handle this at home, or I've got a patient. The case manager tells me like, there's no family, there's nobody here, we don't know what else to do. I call my lifeline. I call Mary at Abode. Abode, like I said, for those that are here in San Antonio and those that are not, and you guys that have been on these sessions, it's a godsend, And unfortunately, they're only, limited on their number of beds. But Mary knows how many times I blow up her phone and saying, I've got this patient. And then I'll tell her, like, you thought the other one really needed your help. This one really needs your help. And so I really try to tap in and see, because, we are blessed in the community with the boat. And I try to utilize, that one first for those patients that don't have, one, family. They don't have the means. They don't have the financial means. They have, we get a lot of John Does, and so we're trying to find. And so we're really blessed to have, a boat in our community.
For sure. For sure. Well, thank you, Rigo. Yeah. Does anybody have any questions for him? Any other questions?
Rigo, I'm sorry I missed it. Can you remind me, like, what organization do you work for?
I work for Embrace Hospice.
So, how does someone get connected to you if, like, they have more than 6+ months to live, like doesn't need hospice, or someone like you, in your position? Does that make sense?
Yeah. No, it makes perfect sense. And I'm here with Embrace as my title, but I've always tell everybody this: I never take my social worker hat off. Okay. And so, and only because I have been, in the healthcare system, in the hospital system, and all this, that I've seen the frustration, the heartbreak, the confusion, and everything. And I'm like, man. And honestly, what I always tell myself is, my parents live 4 hours away, and if something were to happen to them, I want them the person that sits across from them, try to lead them in the best direction possible, not what's going to benefit them or their company or get them out of the hospital and now they move on to the next one. I want to make sure that they get a solid discharge plan, to guide them in the right direction. So I know she mentioned SAGE earlier. They are a group of social workers out there. But if you're talking about me, you can take. Are you here in San Antonio or?
No, I'm in the Dallas area, but so I'm just curious, like, how would I go about finding someone?
Yeah.
That has like your skill set or not, or knowledge. Yeah, I'm like in the LPC world, So, and it seems like the social worker world is more connected with hospice. And so that's why I was just kind of curious, like how does someone find you? Because golly, like I know it's so hard to navigate the medical community. And then especially, I'd imagine it's like you've said, exactly the same for this as well.
Yeah, no, that's a good, and there's I know I'm old because obviously, apparently not a lot of people use Facebook, but there's a great case management group of San Antonio Facebook page. And so I would probably ask you, maybe there's a case management of the Dallas Fort Worth area that you can tap into, and you can just send them a message and somebody will respond to you. I don't know if there's a hospital that maybe you're a little bit connected to. Reach out to one of the social workers, case managers there at the hospital, and say, I mean, like I said, are they all going to be? I'm hoping that they do, because we all take a vow to help and guide whatever resources we can. And it's more than just giving you a sheet and saying, oh, here's a list of people, call them, good luck and everything. I mean, I know that happens, but I know there's got to be other people, other social workers that want to take the time that, you know what, even if your mom wasn't looking for hospice, that's beside the point. And I hope that, people that I've, met along the ways, I'm not, oh, I think your mom needs hospice. I think your dad needs hospice. No, I think your mom needs some help. What about a personal care home? Have you tried this assisted living? Oh, you didn't know about this assisted living on this side of town? Yeah, they're great. This is your contact person. Let me tell her that you're going to be giving her a call. So, but to again answer your question, there's Facebook groups of case managers, of social workers.
Yeah.
There's social work associations in the DFW area that I know somebody's bound to kind of direct you in that direction.
Yeah, that's the phrase that I needed, was case manager or case management. And then now
Absolutely.
that answers it.
Senior resources. I believe SAGE is nationwide, I think. But
There's SAGE, there's SWAN, there's here in San Antonio, there's SWAN, there's Social Workers Association Network. I mean, there's different agencies of groups out there, and I could only assume if San Antonio has something like that. I know Dallas, Fort Worth, surrounding area would have the same.
Thank you.
Yeah.
Leslie, Mary Lynn Garcia just left you a message. You see that? Okay, good. All right. Well, thank you so much, Rigo. That was wonderful. That's a lot of information. Man.
It is, and I apologize. so, it's just something I'm very passionate about, and I hope, I know I can get long-winded and stuff, but it is something I'm very passionate about. So,
Great, thank you.
All right. Well, next I want to introduce Mary. You all know Mary, but Mary's going to talk to us a little bit about her journey with all of this. And Mary, as you all know, is our executive director of ABODE, and she's been with us almost 2 years. She's going to be 2 years pretty soon.
Yeah.
And she has just made a phenomenal difference in our lives, and is very passionate about her work, and very passionate about the people she cares for, very passionate about the people that work for her. And that makes ABODE a very special place. So Mary, when you please do the honor of telling us about your mother's journey?
Sure, and thank you so much, Beverly. That's a very sweet introduction. My story is kind of coincidental. I came to San Antonio to take care of my mother. My dad died several years ago. Mom and dad moved here 30 years ago, so San Antonio was clearly their home. And it became clear she just couldn't live by herself. But we didn't want to put her in a nursing home. We knew she wanted to stay home. And luckily, I just so happened to be at a place in my life and in my career that I thought, well, I can go live with her and take care of her for a year or so. And so that's what I did. So we were lucky. Very few families have someone who can just come and take care of them. And so I was very fortunate and blessed that I got to do that. And then coincidentally, I learned about ABODE. So I was running a little ABODE at my mom's house. And when I got the job at Abode, I would come to Abode, where we take care of 3 people at a time. And the timing just worked out beautifully. We are in our 7th year at Abode. In fact, our co-founders, Edwin and Patsy Sasick, are on the call. And I mentioned last week, June Ferguson is an early supporter, Ed Alderete, so several of you on the call, and Beverly, of course, as a board member, and Susan Ruck as our volunteer coordinator. We are a wonderful community of people who just, it's just the most beautiful place. So we're in our 7th year. We have cared for almost 220 individuals since Patsy and Edwin opened the doors. And our guidelines are primarily, as Rigo mentioned, 3 months or less is what we try to keep our limit to, so that we can care for more people during the year. We have just 3 rooms with 3 private bathrooms, absolutely beautiful. So if we can get folks who are truly at the very end of life, then we're able to care for quite a few people. And it's the trickiest part of the job, because you just don't know. In fact, today we were all set to take a gentleman. Diana on our team saw him yesterday, and she said, "Mary, I think he's 3 months. He's definitely declining. So I think he'd be good for us." He died today. No idea he was going to die today. So Rigo, I expect you to send me a text message right now.
There's a bed at Abode.
Texting me. We do get our referrals primarily from hospice folks like Rigo or Beverly, who will say, "We've cared for this person for X amount of time. We've seen the decline. They can't stay at their home by themselves anymore, or their family members, as Rigo and Beverly told you, are just exhausted, or they have no home." And that's a tricky one too, but we do try to pick folks who need us the most. We usually have a waiting list. We look at the folks, and it's really the ones who just need us that we go with. Our other guideline is a weight guide, believe it or not, because our caregivers generally work 1 at a time around the clock. We can't move a hugely heavy person, so we try to keep it to 200 pounds or less. And I'm always surprised by the number of big folks out there. So keep that in mind to all of us as we age. It's hard to take care of somebody who's really heavy. Anyway, and I think probably the most important thing when somebody's coming to Abode is that they understand that they're dying and that they're coming to Abode to die. And that's where our team really shines. We give wonderful care around the clock. We feed you anything you want, anytime you want, or not if you don't want to eat. You're always clean, there's always interaction. But when we can deliver that end of life conversation, how to know what to expect, what you're going through is part of the process, and let us just be with you during that process. That's what I think makes us so different. Our name is Abode Contemplative Care for the Dying, and the contemplative part simply means we are in the present with you. We are paying attention. We're not rushed. We're here for you. We meet you where you are, and our job is to walk. Oh, I get teary. Our job is to walk along with you during your journey. You're not just a number. You are here, and we're with you. And that's where we really get to shine. So when we get folks, we can have them for a couple of days, a couple of weeks, or a couple of months. That's wonderful. Sometimes folks come and they die that day or the day after, 2 days later. Some folks come here for 3 months, but if we see that they are declining, we'll keep them. It's the ones who get better that are also a challenge to us, because often they'll come, and because of our love, our regular medication, our nutrition, the interaction, they get better. And we have had several folks lately. I thought maybe we should change our name to Abode Contemplative Care for the Living. Several folks have genuinely bounced back. And then we ask hospice, work with us to find another place because we are not a nursing home. We're not a long-term care facility. But again, it is the trickiest part of the job because you just cannot predict it.
And you can't make a reservation. Like I couldn't put a reservation in.
No, you just interesting how when somebody passes, we'll just get just the right call. Or even today, after we had accepted a gentleman, another referral came in. I thought, oh, that's too bad. We could have, you know. So I called them back and said, guess what? You just never know. Um, what else can we say? Oh, the most important part, well, not the most part, one of the favorite parts is we do all of this at no cost to our guests. Nobody pays a dime to come and stay at Abode. We run on generous donations from folks like all of us and grants, and those are very competitive. But one way everyone can help us is let us know if you know of a foundation or an organization that is generous and that this might strike a chord with them, or if you've got some deep-pocketed friends and you think that they might be interested in knowing about us. Monetary donations are what really help us. Well, they're what pay our bills. So we certainly welcome any leads like that. And we welcome volunteers, as Beverly mentioned. We're doing some volunteer training in August, and we'd love to have you all be a part of that. But yeah, when Rigo says, you know, as somebody is at the very end of life, if they can come to Abode, it's just the most beautiful experience because, oh my gosh, I still get teary when I talk about it. Because what we can do is alleviate the stress of the loved ones, the family and the friends. If they have loved ones and you know, family and friends, we take away all the stress of them having to care for their loved one. We do all that for them. All they have to do is come and be there with them.
Mary,
Yes.
did your mom know that she was dying? Did she accept what was happening? How did you experience that with her?
Yes, and she had told us a while back that she was not afraid to die. She'd had a wonderful life, and our dad died 10 years earlier, and she missed him very much. But when she couldn't do what she loved to do, and she couldn't hear, and her bridge game was suffering, she was done. She was like, okay, I'm out. And it was just a matter of time. Beverly was her hospice nurse. And there were numerous times when I thought we were going to lose her. She had congestive heart failure, numerous times, and she bounced back. And finally, one morning, she just didn't wake up. She had this breathing, heavy breathing, and I took a little video and sent it to Beverly. Even though I work in this world now, I'm like, what do I do? Where's the magic pill to wake her up? And Beverly texted back, and she said, just support her.
Thank you.
And
If I
it's
had not been
interesting.
able if I had not been able to take care of her, to take her from the bed to the porta potty, if I couldn't have done that, I would have brought her to Abode if we had an opening. But luckily, I was able to care for her. Yeah.
Yeah, and it takes a village. I mean, Mary luckily had the help of her sister.
Yes.
And, you know, I remember, you know, Mary's mom was perfectly coiffed until the very end. I mean, she dressed every day, jewelry, hair. And the Friday before she died, I sat with her at the kitchen table and she just looked me in the eye and she said, I'm going to die soon. So she knew. She didn't last another week.
Nope. She knew before I did. Yeah, I knew she was going to die soon, but not that soon. It was a Friday, and she died on a Tuesday. You just never know.
Nope.
Any questions about Abode and qualifications needed, or? Okay.
We're just very lucky to have this in our community.
Yes, we are.
You know, when we do hospice stand up in the morning, and I'm sure all hospices do this because a lot happens overnight, and it's always like, and there's a bed at Abode, and our social workers are like, oh, you know, so it's
Oh, yeah.
it's a wonderful gift to our community, and but this is a huge challenge. And I was a nurse in a hospital for many, many years, and then I ran a heart failure program. I had no idea. I had no idea until I got into hospice, just the desperateness that's out there. It's hard to take care of a loved one, and you can't do it alone. You can't. You need a village. You need people to help, because as they get sicker and sicker and more frail, every bodily function has to be helped. So, they become bedbound. They have to be changed. We got to prevent bed sores. It's a 24/7 plus job. And I really hand it to all of you out there who are in the middle of it, who are the beginning stages of it, or who have done it. And I'm going to give a shout out to Mary Rogers. I've got my thing. I was looking for you, Mary, but I was Mary's husband's hospice nurse, and Mary did a superb job taking care of her husband, but it wasn't easy. It was not easy.
Thank you. I had it on mute because Ellie was making noise. Thank you. That your praise comes. I cherish it. Thank you.
For those people that are out of town, Leslie, and then I think the other woman signed off already. If you can look up Omega Home Network. I quickly checked. I thought I saw 2 in the Dallas area, but one is like under construction or just beginning. But if you're looking for a place like Abode, there is a national, the Omega Home Network.
Good
And
point.
it's their end of life homes.
Excellent. Yeah.
That's good. Thank you, Susan.
Mhm.
Yeah, and Abode is part of that network.
For Patsy and I to be here and sit and listening to the stories that have been part of the Abode story, to hear Rigo talk about the process of finding homes for people at the end of life, or a place for them to go, and to imagine that Abode does really meet the need in the community as we knew it would. And so it's just humbling to listen to the stories, and to imagine that tonight at Abode there are 2, if not 3 guests who live there now, with staff and volunteers caring for them. It's an amazing thing. So anyway, just enjoying listening a lot tonight.
We are.
Good. Well, I think that wraps up our program tonight. Next week is, again, managing the family dynamic. Again, tough subject. And it's going to be Byron Cords of Sage Management. So if you had an interest in Sage, or kind of want to know what Sage does, tune in next week, and we can pick Byron's brain. So any last words, Rigo?
Yeah, I just, again, I appreciate the opportunity to be here. If anybody has any questions, obviously they can get my contact information. I'll be more than happy to guide. But the last funny thing I want to say, and this is obviously for those that have their loved ones in the hospice care, y'all, there's a social worker as part of that team. Utilize the heck out of them. That's what they're there for. That's what we're here for. We all see the nurse and the aide, and absolutely they're the critical part of the care team. But the social worker is right there too. That's part of the benefit that comes with the hospice care. Let them do a lot of the legwork, a lot of the research, a lot of the brainstorming, so you can be there for mom, dad, love on them, care on them, and let the social worker do all the legwork. All right. And I hope a lot of social workers don't throw, tomatoes at me, but I'm being honest. That's what we're here for, and it's not to just give, here's a sheet, make the phone calls, whatever. No. Let me help you. What is it that you're looking for? What is it? And let me, present to you what I found for you. Okay, because you guys are, they're caregivers, like we talked about from the very beginning. Caregiver fatigue is a huge issue, and if we as social workers can take a little bit of that off your shoulders, then utilize it. That's all I got to say.
Thank you.
Thank you.
Have a wonderful week, everyone. And thank you, Mary.
Thank
Thank
you.
Goodbye, everybody.
Bye.
Thank you.
Rigo. Good night.
Right.